Hello, my name is Wes Hayden, President and co-founder of CoachCare. In this video, we will talk about a question we get from practices of all sizes. Do payers really pay for remote patient monitoring? Many providers see the value in RPM in terms of revenue generation and improved outcomes, but will the insurance companies really send me the check? The short answer is yes. Here are examples of de-identified EOBs from our actual clients showing payment for the RPM codes, which are 99453, 99454, 99457, and more recently, 99458. And you can see these include examples from Medicare here, as well as commercial payers like Blue Shield and Anthem as well across these different codes. And I can tell you, we have clients making much more per patient than these EOBs show. So these are, on the more conservative side. So also here are examples of healthcare organizations having success getting paid for RPM, not just on individual patients like that, but at a large scale. So here you can see that our client CoreLife, a fast-growing national physician group, grew their remote patient monitoring program from zero to nearly $100,000 in monthly revenue with almost 500 patients. And also here you can see how our client, the Herndrecht Center, a large physician center of excellence, grew its remote patient monitoring program from zero to over $17,000 in monthly revenue with nearly 100 patients. And you can really take some of these revenue numbers we shared and extrapolate them for your patient population. We've seen this work well at all sizes. And along with those proven results of providers actually getting paid for RPM, CMS has clearly demonstrated support for RPM services because they align, with the broader transition to value-based care. And you can really see this evidenced in the 2021 Medicare Fee Schedule, which basically kept reimbursements in line with 2020 at a time when reimbursements for many other services decreased. The fee schedule also, it increased the flexibility for providers by allowing them to utilize auxiliary staff and to support additional diagnoses that hadn't been clarified before. So really all of this makes RPM even easier to implement and to generate robust reimbursement, both with Medicare and with commercial payers. So let me take you into the Medicare fee schedule so you can see some of these actual rates. So I'm going to type in a couple of the codes, 99454, for example. You can see all the modifiers. And you can see the actual rates that Medicare is paying by region. And let me do the same thing for 99457 here. So same thing, right? This is across all different regions here. And this is publicly available information. So it's clearly showing that Medicare pays for these services and the rates are good. So you can go on here onto the CMS website and you can search these to see the rates for your own region. So while CMS was the catalyst for RPM, most commercial payers are covering RPM now as well. So over the past 2 years, we have built a proprietary database of commercial payer coverage for RPM across over 100 payers throughout the US. And you can see that on the screen here, just a screenshot of it. And this is based on hundreds of hours of phone calls and emails with payers on behalf of our clients. A lot of elbow grease going into that. But as you can see from the screenshot here, if we work together, we'll actually be able to pre-verify the coverage for your specific payers when we implement your RPM program. So these are, just across, different states, but we'll be able to do that for your individual payers as well. And along with that proof for both CMS and the commercial payers that I just showed you, here are examples of testimonials from other clients that we have of different sizes, from independent practices on up to large health systems, affirming their payment for RPM services. Real providers are getting paid for this. And here's yet another client testimonial to highlight the positive impact that our own actually CoachCare billing experts made to help ensure our clients could get paid for RPM. So now I'll answer a few common questions around this topic of getting paid for RPM. So first of all, why are reimbursement rates so high? Well, pretty simply, payers want providers to deliver these services because they are less costly than hospital admissions or other complications that can occur otherwise. In short, they lower the overall cost of care. Why do nearly all payers cover RPM? Well, as we discussed, CMS is highly supportive of RPM as it is proven to reduce overall healthcare costs. And most commercial payers have taken CMS's lead by instituting RPM and more at it each year. The reimbursement rates are strong and eligibility has actually expanded, so a broader range of providers are now able to deliver these services and a broader range of patients are able to receive them based on their diagnoses. What payers don't cover RPM and what do I do if one of my payers doesn't cover? Great question. So as I just showed you, we have directly pre-verified coverage by over 100 commercial payers in over 30 states. So it's unlikely that many of your payers do not cover RPM at all. And while you must consult your payers directly for final confirmation, what we can say is as of this recording, we have found generally that Cigna and certain Blue Cross affiliates are not covering RPM right now. But don't worry, we're actively advocating with their medical councils to begin coverage, and we hope that they will adopt RPM soon. We've actually had some success with at least one Blue Cross affiliate getting them to add a new policy, which is great. And as far as what to do if one of your payers doesn't cover RPM, well, just remember that the reimbursement rates are robust. So this means that even if you can't, you can only deliver RPM to a subset of your patients who are covered, it's still incredibly impactful and worthwhile for your practice, both in terms of revenue generation and the improved patient outcomes. So in short, you should still offer RPM to your patients who are covered. A couple more questions here. Does this work in my state? Short answer, yes. Medicare covers these services nationally, and we have directly pre-verified coverage by over 100 commercial payers in over 30 states. And are reimbursement rates good in my state? Well, Medicare reimbursement rates are set by region. I just showed you some of those regions earlier, and they're adjusted for cost of living. And then, along those lines, commercial payers typically follow those Medicare adjustments, but ultimately you can look up your actual reimbursement rates by contacting your payers, and we'll help you do that as well, if we get started working together. So I hope this video has been helpful. For those of you who are not familiar with us, over the past 7 years, CoachCare has worked with thousands of health systems, physician groups, and independent practices to support their virtual health and remote patient monitoring needs. To learn more, all you need to do is schedule a Q&A and tour of our technology. I'll answer all your questions about RPM, and together we'll calculate how much you can make by implementing RPM. And there's a link to book a call alongside this video. Thank you.